Hi, I'm Ashton. I know so many of my videos recently have been like transition related, especially top surgery related, but that's like what's happening in my life right now, so I don't really feel all that bad about it. Today's the 27th, and I have my post-op appointment. I'm probably not going to record while I'm there, but I will, come back after and tell you what'll happen. Just before the post-op, I am still wearing the binder, of course. I have drains on either side. I'll put pictures of those here if you don't know what the drains look like. So the main thing that's happening today is that I'm getting the drains taken out. The scar tape also comes off, so I'll get to see the incisions for the first time. But yeah, I'll keep you updated.
Can you see everything? Can you see the oh well, I'll just move around when I need to show you different things. So, today was the post-op. I got to see everything uncovered for the first time, and it felt really good. A few things happened that I wasn't really expecting would happen. So I'm going to tell you about that, and then I'm actually going to do something that I haven't done before, and take off the surgical binder on camera and show you everything that I can. I'm going to take off the binder and show you stuff as they did. Does that make sense? I'm going to take off the binder and point to things to where they did things today. So this is the first time that you guys are actually seeing my chest. It's not in a picture. I only have 3 more days of wearing the binder constantly. I get an hour without the binder every day. There is some blood on this binder, but that's normal, especially after a post-op. So they did things like side by side, like they did everything on this side first, and then they did everything on this side. But essentially, the first thing they did was they took out the drains. So I'll put a picture in here, but I used to have drains, surgical drains. They look like little penne pasta noodles on my sides here, and oh man, I really hope this is a good enough angle here and here. When you take out a drain, there's like a hole there, where the drain was. I covered that with these little bandages. You can see it, you can lift up the bandage, but there's a hole there. There's a lot of drainage still coming out of the hole because of all the manipulation that I went through today. These do not want to come off. This nipple, there was actually some problems with, so I'm going to go through that in a minute, but I'm going to go through normal things first. You can see the scar tape here. It completely covers the incisions, but there is not as much on as there was before because we took the staples out today. So there were like maybe 15 staples along the incision. Taking them out did not hurt as much as I expected it to, so that's, a perk. That's a nice thing. Because this bandage is practically soaked through, I'm actually going to replace this. You can still see a lot of the marker because that was under a lot of the dressings before, so I couldn't really wash it off. I should take this off too. I put on a bit of a bigger pad on this side just because there is so much drainage coming from that hole. It is the bigger hole. It's the one that had more drainage when I had the drain in it, so that's normal. This adhesive may also not stay on all that well because we did put Neosporin on the drain sites just to help them heal a bit better, hurt a bit less. I was quite worried about the pain of having the drains taken out, but actually that was the easiest part. So the nipple dressings that I had before had adhesive on them. And you can probably see around here, my skin got extremely irritated by those, and it's like very raw, and it like bled at some point, so now I am just using this gauze instead, and the gauze is like held on by the tightness of the binder. So my chest is, and you would expect it to be, quite swollen. It's not terribly swollen though, like there's a lot less swelling than I expected there to be. The surgeon also said that the incisions look like incredibly good, and she thinks I'm gonna have really nice thin scars, so that's exciting. This side did drain less than the other side, so she does want me to like massage towards the drain site at some point, like once a day or twice a day, to keep that drainage going. But I'm not going to do that today because she did so much manipulation at the appointment. So we've talked about the incisions. I think we've talked a bit about the drain sites. I should talk about my nips. So this nipple is healing pretty damn well. You can see that the scab is actually mostly coming off. My surgeon did like scrape the scab off, which didn't hurt, it just felt really weird again, because so much of my chest is numb, especially the nipples. But this nipple's healing up really well. You can see the kind of pinkish baby skin that's underneath it. Some of the sutures are already falling out, which is normal and healthy and good. It's definitely getting blood flow. You can, like, there's some blood seeping through it, but this nipple is normal and good and fine. Now we're going to talk about this side. This is the side that I'm having problems with. It is also swollen. This side is a bit more swollen because there was less drainage there. This side is mainly swollen around the nipple, and I feel like part of the reason behind that is because she did manipulate it so much today. So when she was looking for like pockets of fluid or anything, we found one under the nipple. So there was like this rust-colored ooze coming out when she pressed on the nipple. So she did that. She kind of massaged towards the nipple, and a lot of blood and like kind of white pussy stuff came out. It's not infected, she did say that, so that's good. But it is, you know, still something that we have to watch. Some of these stitches popped out as she was massaging towards it to get the fluid buildup out. And it popped the sutures here and here. You can probably see it's a bit more irritated. I'll take a video on my phone too, and I'll pop that in here with this audio. You can probably see the places here and here that the stitches are coming out. She did not want to restitch them today because there is still a little bit of fluid coming out of those two spots, and she didn't want to stop that drainage from happening. But we have an appointment set up in a week, which is like just another post-op, and she will probably stitch up those sides then to kind of reattach the nipple. As I continue to put nitro on it, which is this stuff, it promotes blood flow and it helps get like vessels connected to my nipples again. She suspects that it will mainly heal up by itself, but it wouldn't hurt to put stitches back in to just make sure it heals, you know, attached to my skin. But it actually looks a lot better right now than it did at the office when she was manipulating it. So, you know, that could be part of it too, and it's probably already doing its healing. So yeah, that's my chest exposed to the world. I'm not going to show you the incisions just because I don't want to have to remove and replace the scar tape. But as soon as the scar tape does start falling off again, which is a normal thing as dead skin builds up and as it heals and, you know, scabs over, I might take a video of that. It probably won't be in this video, but it'll be in a video. That's my chest so far. My range of movement, which I do in a catalog, is like, this is as far as I can raise my arms, but my elbows are fine. I was pretty sore after the post-op just because of so much manipulation around my chest that I wasn't used to. But yeah, my surgeon thinks that other than this nipple, I'm healing up really well. She said she's not that worried about this nipple at all. She was actually more worried about the abrasions on my skin from the adhesive than she is about this nipple. So it's not that big of a deal. I'm sure it's like a very common complication and she knows how to deal with it. I'm just going back in a week to get it re-sewn up. And as for now, I'm just putting nitro on it, taking care of it like I would any other nipple. But yeah, so this was my post-op appointment, and I guess a little reveal to you guys since you haven't really seen it yet. I want to show you a side view, because this probably more shows you the swelling and a little bit of the nipple placement that you haven't seen. The swelling is, again, not that bad, but you can probably see it around here if I turn a bit more. But yeah, I'm flatter than I've ever been, even with this swelling, and I'm really happy. I guess I'm gonna sign off, put some new gauze on my nips, and go edit this video. So, thank you for watching. Goodbye. I hope you have a day where your nipples are not having any complications, and I will talk to you later, maybe.